Hi guys, welcome back to my channel, Chronically Minimal. I talk about all things chronic illness and share my journey to live a more simplistic, minimal life. Today is going to be a quick and dirty because one, I'm frustrated, and two, I don't have the time I need to put up a video this week. And my dog is licking my plate. Sorry. Bella just had her surgery yesterday, so she's a little out of it and disoriented. Hi, sweetheart. So, do you ever get frustrated with the medical field, their lack of attention to you, or making you feel like you're not important? I certainly do. So today, I thought I would do a quick video on some of my tips for self-advocacy. Again, this is quick and dirty. I'm still in my pajamas. I'm eating my lunch because I have to run to an appointment here in just a few minutes. But I've had a really frustrating morning, and I wanted to kind of talk about it and share some of my thoughts as to how you can advocate for yourself when it seems like nobody else wants to. Bella, where's your bone? So, here's my problem. I've got a couple of them. So, earlier in the week, I had my second COVID vaccine, and because I have a condition called idiopathic angioedema, it basically means that my body can have an allergic reaction to nothing. So we kind of anticipated going into the vaccine that I may or may not have trouble with it. The first vaccine was fine. I didn't have any symptoms. Everything went off without a hitch. It was the second vaccine that I got on Tuesday where I started to get like the congested lungs and short of breath and itchy. Ended up going to the ER, steroids, Benadryl, Epi, all that stuff. So today is Thursday. It's been 2 days since I had my reaction, and one of the things that they told me was to follow up with my doctor. Easier said than done. So I'm still having some symptoms today, and I don't know entirely if they're related to the allergic reaction or, oh, hi, Bella. Oh, hi. Or if because it's like the middle of pollen season and my lungs are just irritated, I'm trying to get back on some medication for my asthma that we haven't been able to get approved. So there's a lot of factors. But regardless, I need to get in to see my pulmonologist to talk to him about what's been going on. So first thing this morning, I called the pulmonary office at my hospital and requested an appointment with my doctor. Oh, well, you're having trouble breathing and you're short of breath. You just need to go to the ER. No. First of all, the ER is not the solution for everything. And second of all, I can have asthma and trouble breathing and not be in danger for like suffocating or whatever. I'm tired of people jumping to the conclusion that just because I need something now means I need to go to the ER. I don't. I'm so tired of the emergency room. It's not the solution to everything. In fact, it's hardly a solution to everything. But that's a topic for another video. So they say that they'll get a message to my doctor and somebody will call me back. Well, now it's 12 o'clock on a Thursday. I haven't heard from my allergist or my pulmonologist about a follow-up. I'm having other complications from other things that have happened earlier in the week that also have to be addressed by the end of tomorrow. So I'm kind of in a time crunch. So I've already talked to my primary care doctor today, had a really good appointment with her, which is my first recommendation for self-advocacy is to have a primary care doctor that knows you, understands you, and can help you in situations. But not just that, but they know their limitations. So I talked to her about the pulmonary issues I've been having, and she said, given your extensive history, I just don't feel comfortable treating you right now. I need you to get in touch with your pulmonary doctor and get his recommendation. So, like I said, tip number 1, have a good primary care doctor that you have a good relationship. Always keep them informed of things that are going on with you so that when you need something, you don't have to catch up everything that's happened in the last week or the last month or the last year. Constantly be in contact with your primary care doctor, because they can sometimes be your biggest advocate when you can't advocate for yourself. So that's tip number 1. She, like I said, recommended that I follow up with pulmonary. So earlier this morning, I talked to the pulmonary clinic. They told me to go to the ER, which I said I'm not going to do, and that they would call me back. So 12 o'clock rolls around. I've already talked to them once. I've talked to my primary care doctor, who said that I need to follow up with my pulmonologist. It's Thursday afternoon. What do I do? So I call the office back and I say, hey, look, this is what's happened. I don't need to go to the ER. I just need to follow up with my primary care doctor, with my pulmonologist. Sometimes you have to be persistent. And that's my second tip. Be persistent. Because sometimes the nurses or the clinicians or the office that your doctor's in, they don't know everything. I asked if my pulmonologist had clinic this morning or if he was going to have it this afternoon, because I know what his schedule is. And she said, well, I know he has clinic on Tuesdays and Fridays, but I don't think he's in the clinic on Thursdays. And I said, he has clinic on Thursday. I just don't know if it's morning or afternoon. She said, okay, let me get in touch. Or she looked at his schedule and she said, oh, he is in the office this afternoon. Shocking. Know your providers. I'm not telling you to know their schedules, because that's sometimes not necessary. But also be in contact with your specialists to know how far you can push and how far you need to push when you have to advocate for yourself. Thankfully, this is a physician that I have been seeing for the last 7 years. He knows me incredibly well. He has literally saved my life more than once. He knows me inside out. So, and I guess to back up a little bit, this nurse that I was on the phone with, she was like, well, you can see one of the nurse practitioners tomorrow afternoon at 4 o'clock. And I'm like, okay, a Friday at 4 o'clock. If something else needs to be done, that's not going to work. And that's when I insisted on her looking at the schedule. Well, of course he's overbooked this afternoon. So you can still see the nurse practitioner tomorrow. How about you get in touch with my doctor and you ask him if you can overbook him with me? Fine, I'll put you on hold. Great, thanks. If that's what you need to do to get me in to see my provider, then put me on hold. She comes back and says, oh, we can overbook you for this time slot. Can you come in and see him now or then or whatever? I'm like, yes, absolutely. Which is, I need to leave in about 15 minutes. So my video is not going to be up at 2 o'clock, but it'll at least be filmed. So recommendation number 2 is be persistent. Know your doctors, keep them informed. So if I didn't know my doctor and his schedule, I wouldn't have known to be as persistent. And I know that that's not like a hard and fast rule, but you can still be persistent without knowing their schedule. So if I didn't know that he worked on Thursday, I could have said something like, can you look at his schedule to see if he has anything today or tomorrow? Or do you know when he'll be in the office? Or is he in the office right now? Like, there are certain like probing questions that you can ask to get more information. And when she went and looked at the schedule, lo and behold, he's in the office this afternoon. Oh my gosh. Like, I don't know why it's so difficult. And I'm not trying to pass judgment. I'm not saying, I know that nurses and doctors have so many patients and so much going on, especially with the state of the country right now. But there's also a point where you have to let people know what you need. You can't, I'm not being aggressive. I'm being persistent. I'm asking all of the questions, and I'm continuing to push myself into the situation. And you have to be willing to do for that in order to advocate for yourself. So I guess my third recommendation for advocacy is to look for somebody who will help you. If it's not your primary care doctor, if it's not the doctor that you typically see, if you need something urgent but it's not an emergency, look at other practices. Call other doctor's offices. I had to do that for another follow-up thing that I'm having to deal with right now. Needed to get in with this specific doctor. Well, he only has clinic twice a month. Well, I can't wait 2 weeks to get into clinic with him. So I asked my primary care doctor for recommendations for other doctors I could see, because it's, again, something that has to be addressed before the weekend. So in spite of pushing to get seen her and talking to this doctor's nurse, there just wasn't anything I could do. So I called another practice. They said, oh, we can see you tomorrow at 11:30. Great. I need this taken care of before the weekend. This is who I can see, and this is how I can get it done. So don't confine yourself to only the people that you've seen before. If you need something addressed, there's always, 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 always going to be somebody who can see you. Don't let the system fool you and feel like you're only stuck inside this little box, because there's always an option. That's not necessarily the emergency room. Could I go to the ER and get this other problem addressed? I sure could, but I don't want to go sit in the ER for 8 hours and have nothing accomplished. I have things to do. I have a dog who just had surgery, so I can't just, leave her in the house unattended for 8 hours. Anyway, so my tips. Have a primary care provider that you know well, who knows you well, and who can advocate for you. 2, be persistent, because there are so many things that I wouldn't have gotten taken care of without being persistent. And sometimes you have to get uncomfortable. I'm not a pushy person. I am one of the most passive people you will ever meet. But when it comes to my body and my health, I know what I need, and I know what has to be done. So just continue to advocate for yourself until you get what you need. And then the third thing is to think outside the box. If all of the options that you've been pursuing are not being fruitful, look at other avenues. Talk to other people, get recommendations from friends, talk to your primary care doctor, see other ways that these issues can be addressed, and hopefully you can find success in what you're trying to do. So I'm sorry that this video was more of like me ranting, and I've just had a frustrating morning, and I thought maybe I can pass some of my frustration off as advice and maybe help you guys think a little bit clearer when you're in a situation like this, and maybe give you some tips that you haven't heard of before. So I hope you all are well, and like I said, this video won't be up at 2 o'clock, but it'll be up later today, and I'll see you guys next week. Bye!